With increasing trends towards chronic ill health, there's a growing need to refocus and reprioritise our metabolic health as a key to wellness. Urmita Hirani from Berkshire has suffered a lot of ill health both personally and in her family. Having overcome breast cancer and supported her husband through MRSA in a short space of time, Urmita was diagnosed with type 2 diabetes. This diagnosis was the final straw. Urmita was prescribed medication but felt unsupported by her doctor at the time. She knew it was time to take control of her own condition in any way she could, and she set out to do this with the help of her husband. In 2018, Fixing Us partnered with AstraZeneca to assist in the journeys of 3 patients with type 2 diabetes, including Urmita. Fast forward a year, and she's reversed her diabetes. In this session, we'll be speaking to Urmita about her journey. We will also be hearing from one of the doctors involved in the collaboration, Dr. Michael Bazlinton, NHS doctor and founder of the Bodymapping clinic. We will be discussing how to effectively engage patients with their metabolic health and how to optimise our time with patients to empower them on their journey.
I was quite embarrassed by having type 2 diabetes. Like, why couldn't I have controlled it better? It was almost a reflection of the way I was living. It's like a numbness. You walk around almost quite numb of what's next. It doesn't leave you. It's just there all the time. So I find it's a constant reminder that I am a type 2 diabetic.
I knew I wanted to be a nurse from a really, really young age. My mum, unfortunately, was diagnosed with cancer when I was 8, and she was cared for at home by a really, really lovely nurse who I absolutely adored because she cared not just for my mum but the whole family, and I really wanted to be her. I really wanted to be that district nurse, so that's what took me into nursing. So from age 8, I knew that's where I was going to be.
I wouldn't even go to the doctors for it, because I don't feel that they actually are there to support me in that respect. It was just, that's the way it's going to be. I don't think there was any hope. The hope was only from myself of saying, how am I going to change things?
If I'm at the same point as you, we're both going to go into that fridge and look at healthier options.
You're not the same point as me because you can cook and you can open the fridge and make a dish out, right? I can't do that.
I think that's what families have to do. They have to embrace the changes in the diet, that it's actually for all of them, because just cooking for one person isolates what is actually food as a social occasion.
There is life beyond rice and chapatis, BP. There is definitely life beyond that.
I didn't say there isn't.
But you've just exampled an Indian meal, and that's not the way.
Because that's what I can cook.
Yes, well then, that's what I'm saying. Let's learn together how to cook other things.
All right, we'll learn. Yeah. Over time, I will learn, right?
I always have in the back of my mind, what's their story? What's led to them being where they are now? And that's often the first point into them changing that round.
The things that I've gone through in terms of having breast cancer and having treatment and my husband being ill, I think has been extremely hard. It was almost the last thing that took me down was the diabetes.
Where your HbA1c is, it's actually relatively low on the spectrum.
It's strange. Type 2 diabetic in the family has never been about us. It's always been about me. Mm-hmm. It's always been mum's got a problem with it. Mm-hmm. And the project has really helped me to identify that actually it's not about just me, it's about us.
My parents both had diabetes, type 2. My cousins have got it. My siblings, a couple of them have got it. Why is it that we've had it in the family for so long without anyone talking about it? I think it's just one of those things that we've all just said, oh well, we got it.
You have a lot of cooking experience.
Yes, cooking, but
so
I
how
don't
can you
cook
say
the
we are
right
level?
things. Making healthier choices, BP. So we're level in a sense.
50% of your cooking experience is
Yes, but
applies to this situation.
all I'm
right?
trying to say is let's learn together.
I think people underestimate how much support individuals or people with diabetes need, especially when they're making big changes really in terms of their diet.
Having family members in India that haven't controlled it and watching them deteriorate over years of visiting them has made me quite aware of it.
Our challenge over the years is that patients with diabetes have been given blood glucose meters and test strips and then been ill-advised about when to monitor.
I don't think I'm quite connected to what my readings show, because they're my only indicators as to how I'm doing with my diet.
When it's taught in a way that patients can make sense of the results, then I think it's really helpful. As you've been learning what foods are influencing your blood sugar levels, so the next 3 days, if you look at all of those results,
Yes.
there is only one that's outside of normal range.
I think I should also look at a little bit of my diet to help you through this.
He did actually commit himself to helping and supporting me more with maybe just cooking.
I think we will get to a point with her where she'll actually be able to go out and enjoy her food, and that she feels able to have those conversations with her family and her friends to say, look, I'm doing this for me, I want to prevent the long-term complications of diabetes, and I'm doing what's right for me.
Definitely at the early days, I don't think I'm nowhere near understanding my food intake and things, but I think monitoring it has really helped.
I think the results are staggering in a very short
Really?
space of time.
Yeah.
We can see a huge difference, I think, from your first 4 days to actually where we're at now.
No, yes, I think that's
So
made
that-
a huge difference, you're right. Ultimately, if this doesn't reverse BP, there is going to be nobody in the kitchen.
I wish it was easier. We are still two separate individuals.
I'd like us to just think about what it is we signed up to, and actually me listen to him more. What is it that he's struggling with?
It's a partnership, you work together, you train together, you have the same level of fitness.
That external support,
It's probably
you'll
not needed
need
as
less and
much.
less.
I think everybody should have a shake of something in their lives, just to halt them in their tracks, to make them realise that there is only one shot at this, and only you have control of this, and you make it the best you possibly can.
We need to come together in the kitchen, I think, more than anything else. Yeah.
What I love about that film is in Urmita's story, everything sort of really focuses around communication in a relationship. And so obviously Urmita's relationship with her husband BP and her relationship with Lorraine, the healthcare professional. And we found with our dad as well, that there were so many ways in which communication was important, where it was lacking, particularly in the way the doctors had spoken to him right at the beginning, and the way he was very sort of disempowered in terms of his health. And I think he never really attached much value to his metabolic health. And so this is something we've seen across other people's stories as well, including Urmita's, but it's a really good example where family members, doctors, nurses can really struggle to connect with the person, or might maybe sometimes think they have connected, but they'll go away and don't do the things that they've asked them to do. So I'm going to introduce Urmita. And Urmita, what are your thoughts on that? Because I know obviously in the film it's quite obvious, there are lots of little arguments and niggles, but what are your thoughts on communication, and where do you think that sort of went wrong at the beginning?
I think it was very much my thing. I think it was all very much like, yeah, you know what you need to do, so just get on with it. And I'm giving you the support because I'm just saying yes all the time, but not really taking on board what needed to change. I think it was, although he felt he was supporting me, it felt very much like it was my thing to sort out, not his, coming along with me. And I think when I shared things, he would say yes at the right time, he would not at the right time, but not sure he took it all on board as to how much it was going to impact him. So I think things, very simple things like just going out for a quick lunch while we were out or something. I'd be looking ahead all the time, and I'd look at the menu. I'd make sure that I've got something to eat on it. Things that I would just give a bit more thought to. He wouldn't give that thought at all. And then he'd be very quick at saying, of course you can eat something there. And I'd be like, well, actually, I can't.
Do you think there's a way that, for obviously mostly it'd be healthcare professionals watching today, so how do you think that can be improved? Is there a way that that can be improved and to really sort of integrate families and friendships more into these journeys?
Yeah, I think what might even help is perhaps in terms of the people involved, like Lorraine and I were actually chatting with BP there. That made a massive difference, BP actually being present. So he would pick up a little bit more from her as opposed to me, although she's saying the same thing. It just came from someone else. And I used to feel that dropped a lot better. So maybe almost like, I don't know, a family group session, a drop-in thing where BP had definitely bought into it, but it would have been good for him to sit around with a health profession actually explaining it to him as well.
What's interesting with your story as well is obviously having had breast cancer previously. Do you think that sort of made the diabetes less of an important thing in a way in the eyes of other people?
I think there were a lot of things, Anthony, that played a massive part of our position in particular, because I think when I was borderline diabetic, it was on the other side of being a breast cancer. I was always told that I was borderline, and at some point when I hit about 40, mid-40s, I would hit it. So I was quite aware of it myself, and BP was as well. But then, like you say, as soon as I got my breast cancer, nothing could top that. It was almost like, God, you've got that. So this is just a little thing we can deal with. And it was almost like it was pushed aside. It was like, you've overcome so much. But that's what happened even with the health professions, which I felt was very much like that. It felt like every time I went in back to entertain the idea that if my HbC is at the lower end, what am I doing? What could I be doing to try and bring it down completely? It was almost like they didn't want to entertain it. It was like, Mrs. Hirani, you've been through a lot. And I thought, well, yes, I know that. But now how can I get rid of this?
Michael was one of the doctors that was really involved in this. And Michael, it'd probably be good just for you to have just to hear your side of things in terms of creating that sort of healthy lifestyle for the long term, and how do we sort of communicate the value of metabolic health? Just be interested to hear your side on and your thoughts on Urmita's story.
Yeah, hi Urmita. It's nice to see you.
Hi, Michael. Thank you.
You're looking really well. I'm sorry it's not in person, but I guess this is a good substitute. So
yes, it is.
Yeah, no, I really enjoyed your film, and huge congratulations for all the effort you've put in. And I just had a picture actually of as you were talking about having just watched the films and yourself talking about that sort of relationship with BP. I had this picture of you sort of being a rally car driver and sort of and BP's in the back seat and loving the ride and having a lot of fun, and you're saying, look BP, I need a navigator, you need to be sitting next to me and reading me the route, and every time these corners come up you need to be kind of pointing me around them, and he's just off staring out the window and imagining his next game of golf, and I just so I think as a patient you clearly are in the driving seat, and that to me as a healthcare practitioner that is so encouraging when we see that. Because I think when we do see that, we see huge leaps forward, and so you're in the right place from the outset. I think what can be more challenging is when the patient with the condition sits in the passenger seat and the family member brings them along and they seem to be driving. That brings up different challenges. So I think your particular situation is probably, I think in my personal experience, tends to have the better outcomes. So, I think you're doing all the right things, trying to get BP to understand that, you need a co-driver, you need a navigator. And I think that perhaps the other, in terms of sort of communicating that metabolic health, how, the value of that. What's interesting is, and perhaps a question for you, Urmita, is did anyone sort of at any point kind of connect the cancer and the diabetes? I know, Anthony, when you were going through the initial work with your dad, it turned out I think that he had a renal cancer. Is that right?
That's right. He did. Yeah.
Yeah. So there we've got two people with diabetes, both with cancer, and I think there's definitely an association there. I think we're not implying causation, but did any health professionals kind of say, did they make connections or draw, and see your health as a sort of holistic thing?
No, they didn't actually, which is really quite bizarre because I think it definitely crossed my mind. It didn't cross theirs. And their question, strangely enough, when I went and had my very first appointment and consultation with my oncologist, the first thing he said was, you're a borderline diabetic. You do realise, type 2, you do realise that once you have your first session of chemo, you will go into full-blown diabetes. And I said, and I must be honest, at that time, I probably was no different to any other health profession, where I just said, well, like, what else are you going to throw me? I've had everything else. So yeah, okay. But I almost felt like, let me deal with one thing and then I'll deal with that later, because I didn't have control over it. But nobody actually spoke to me about that, Michael. So that's interesting that nobody spoke to me, but it definitely crossed my mind.
Because I think sometimes, when people are dealing with the diet, we talked a little bit with Rob about what the meaning of the diagnosis was to him, and how it was just such a blow, and actually coming to terms with that sort of label, if you like, and trying to move out from the label. And I think, sometimes what you had is potentially two labels, isn't it? Pre-diabetic and cancer. And I do wonder whether we, as health professionals and as a system, could actually take a step back and say, actually, there's two things going on, but maybe the solution for both of them is common. And actually there isn't double the work to do. It's actually, there's half the work to do. We can put you on, help you sort of, you're obviously a very motivated person. You want to be healthy. So perhaps with a few pointers, we can point you in the right direction, and that will help. The same work you've got to do on diet and nutrition will actually point you in the same in the same improved outcomes for your diabetes and for your cancer. So, I mean, do you think, Urmita, that would have helped at that time to understand that actually, just because there were two diagnoses, there wasn't necessarily two different approaches? Do you think that would have been
absolutely.
helpful to understand that?
I think one thing that came across a lot, Michael, was how they were quite disconnected. So the oncologist wasn't very connected to my doctors. So it was very much me driving that side of it. I know I feel like I'm always pushing people, but I really want people to be connected if they're looking after me. And it was always like, so has the report made it back to my doctors? Have you got this? And now do you have this? And it was me keeping an eye on my diabetes, not them telling me that I should be watching it. It was just that that was the only first hint I was given. So I felt there was a lot of disconnection. It was very much like I was being looked after by a breast cancer unit that was getting the odd letter maybe every 2 to 3 months from the oncologist, but very much a summary, not of what they'd discovered. That was dealt with as and when I had my chemo. But so that kind of disconnection and really nobody really supporting you through it all, Michael. It was very much like, you're on this road now let's just get this done, and that's one box ticked, and then let's just leave you out there because you are so lucky to be here. I think initially, in Lorraine's defense as well, was she didn't know how to deal with me. She really didn't know how to deal with somebody that has got a vegetarian diet. That was a big thing, because whenever we talked about food and stuff, she was probably on like, Urmita, we need to just test it. And I was like, well, how different is that to what I'm doing already? So I felt very much like, okay, but we were doing it together. That was the difference. Although she wasn't aware of it, what was good about it was I was being able to go back to her and say, oh, that didn't quite work. I got a spike there. I wonder whether this would work. And then it was about us trying to change the recipe or do something to see where I was getting the spikes. Yeah. But it was very much us learning together. Yeah. Chickpeas being one of them. And chapati flour is another one. It was like, put a bit of almond flour in and see if that works. Well, actually that worked. I'd never considered putting almond flour into our chapatis because it's a very, I don't know what the right word is, but it's quite a dense flour. So I didn't know what else I could have put into atta, which is the chapati flour, but it was those kind of conversations. So I think it felt very much like Lorraine was listening, and having her there at a phone call away or an email away was just really good.
I remember one of the things was it was kind of giving you those little projects to do. So I remember with the blood sugar monitoring, you were kind of testing it after. I remember you kept cherry tomatoes in the car, and there were things like that, and you were trying that, and even they were causing spikes. And then like you say, the chickpeas were a big thing, weren't they? Because you were eating those quite a lot. And I think then it was the language. So one of the things, when AstraZeneca commissioned these films, one of the things they were really interested in was the language that's being used by healthcare professionals, and how much of an impact that can have, especially in such short consultation times. And I think you were quite sort of encouraged by some of the responses you got from Lorraine. Like once things started to improve, then it was it was that positivity of finding the positives as opposed to just looking at what you still haven't hit your sugar numbers. They were starting to come down. It was sort of acknowledging that and recognizing it.
It just felt like I was doing it for so long. That's the other thing, Michael. It felt like I'd really cut back on so much, but I wasn't getting the rewards at the bloods. And I think Lorraine was the one that kept me on track. Whereas I think if she hadn't really touched base with me, I could have easily have gone back into, is this really working? And the support, I think, in fairness, I didn't have my GP support me right at the beginning, but at the about 6 months in, and he started seeing the HbCA1 going down, he said to me, Urmita, we'll give this about another 2 months, and then I'm sorry, but we're going to have to put you back on the metformin. And I went, no. I said, I'm going to do this for another 6 months, and then we need to have a conversation, but we're not going straight back on the meds. And it was like me taking back control of saying, I'm not going to go back down your route. We still need to discuss it at some point. I don't want to go just back onto the meds because you thought that was the answer. I think it was me taking back control. It was actually that point, Michael, that I felt like I was taking back control of my own health. Because going back to BP, remember, there's only myself and him at home, and we've got an empty nest now. But it means that we're actually just battling with each other all the time. And this doesn't leave you. Does that make, it's just constant now. And that, I think that's the bit that's quite wearing as a couple or as a person that's going through it, is the constant someone watching you like a hawk all the time, waiting to see where you're slipping up. And it doesn't matter where you're out and about or anything, he'll be the one that pipes up straight away, whereas I'll do it discreetly. I'll always look up the menus before. I won't make a big deal about them at the dinner table. I'll just choose what I want and not talk about it being a low carbs alternative or anything else. I just order it because I do want to feel normal. But then BP will often look at it in front of maybe 6 or 7 people and quite comfortably say, well, I don't think there's much on here that you can eat. And that just puts you down straight away. But he thinks he's encouraging me, remember? He thinks by saying that he's encouraging me, and I'm saying, no, that doesn't help me at all. So do you think, I don't know.
Do you think, I mean, we talked about sort of family sort of support. Do you think if your surgery had offered a Zoom call with, say, 3 other couples, so 8 of you in total, or maybe 10 in total, or other family combinations, however, obviously each family is in a slightly different situation. Do you think he would have seen his role, alongside other people in a similar position to him? And do you think he would have been able to learn accordingly? And maybe that part of the solution lies in the concept of sort of group support and group kind of encouragement and motivation.
Absolutely. I think that would have really helped us. I think anywhere that would have pulled BP in without him feeling like, here she goes again. Because I am a dog with a bone with certain things. And this is my thing, which I really won't let go of. And I think I just get really annoyed that I've done so well to get this far. So please just ask me if you don't know the right words, but don't just bring me down. Because then that's the other thing, Michael. It puts you out for the whole day. So he just we need to hear it as a couple. We need to hear it as a couple because I need to hear it from other people as well. And I'm not saying I've got it all right. I need to hear it from health professions about what I'm doing and that's wrong as well. So if we went to a group session, it would be really good that we both get to hear.
Yeah, I think sometimes, I mean, sorry to interrupt.
No, not
I think we sometimes talk about the sort of a conducive to the behavior change that you're trying to pursue. And I think you're right. It's not just, your diet, you've got diabetes partly because of possibly your genetic predisposition. You spoke about other family members having it.
Yeah.
But it's also the food environment in which you live, and the social environment, and the home environment. And so actually the solution has to take all those into account. And I think sometimes, talking to other people who have had a diagnosis of diabetes, there's a sense of they're the solely responsible for it. And actually, and you can roll that out, to the sort of more, the supermarkets where they put, chocolate bars at the end of the aisle as you're queuing up. And and I think so it's trying, how can we change our environment? And I think the environment is primarily our home, isn't it? And, it's, so I think, so having that sort of environment that actually supports you. So in a moment of weakness late at night, when you just feel like, a snack, if there is no flour in the house, then you can't make a chapati.
Exactly. Something like that. But it's,
and I think so I'm hearing that, it's about the solution lies not just in the individual with the diagnosis, but in the whole family, isn't it? And so we need to address that. I think there's much more movement within the NHS, and sort of further afield, and certainly functional medicine, where community sort of group sessions where you have a health coach or a GP or a nurse, or actually working with a lot of people, then that's eminently more scalable. So, because one of the things that I think we find as a challenge is having the resources to do that. I think in some of my other roles where I sort of do as well as my sort of NHS family medicine, the roles I have into looking more of a functional medicine route, which is looking for root causes, of common. So for example, we talked about, could the breast cancer and the diabetes be related? Obviously, we need to treat the breast cancer with, with surgery, with the right medication. But underlying that, is there something we can do in terms of diet, lifestyle, nutrition for you that actually reduces the risk of reoccurrence of breast cancer, reverses the diabetes? And I think one of the issues with that is it's individualized and personalized medicine, which at one level is what you're asking for, isn't it? You say, I need that level of support that understands me and who I am. And of course, that's incredibly intensive use of resources. That's a lot of time of quite expensive, highly trained people, nurses, doctors, and actually, which we don't have a lot of. So how can we so I think sort of group work is more and more seeming like the sort of ideal solution, where you have one clinician working with 10 people, then and you can pretty much, I'm sure that the challenges you had, although not identical, will probably be very similar to the challenges someone else is having. And actually at the end of we've all learned from each other, and actually probably the healthcare professional is learning as much about managing the behavioural changes.
I totally agree.
And Michael, do you think this pandemic has opened up opportunities there? I mean, obviously you're now conducting a lot of your consultations. I know this morning you're kind of on consultations with patients. And so do you think it's allowed you to do things in a different way, and we've now got the options to do that, maybe include family members and things like that?
I think it's interesting, isn't it? I think we're still seeing people face to face. I think we are. So there's nothing like, there's certain things you have to see people for and examine for. I think it has certainly moved, I think, the technology on in terms of kind of communicating via phone and Zoom. I think, yes, I think it has. I mean, I think the bigger pictures, I've got lots of thoughts on about it, which probably aren't that relevant here. But I think what is interesting is actually we've got a sort of infectious disease that has actually changed the world. And for some people, it's pretty devastating. For a lot of people, it's not. But for the people who it is devastating for, also tend to be the ones who have poor metabolic health. And what I am a bit disappointed on it, the solution hasn't really, from our political leaders, we haven't really heard much about the solution. I mean, to be fair to Boris, I guess he has admitted that if he was a little bit trimmer, he probably wouldn't have suffered so much. And I think he's correct in that. But I think, that I would like to hope that one of the long-term positives that come out of this is a real sort of motivation from individuals and from healthcare itself, that actually, we've got another epidemic going on, or pandemic of poor metabolic health. And where poor metabolic health meets a really vicious communicative or communicable disease, such as a virus like COVID, then you've got your worst case scenario playing out in front of us. So I think, I think on one level, yes, there's a few sort of positives in terms of how we communicate, but I think there's a lot of negatives. We've become a lot more isolated, which I think is a disaster. And I think one of the, coming back to the sort of, if you look at, breast cancer, diabetes, there's lots of evidence that actually outcomes, if you put people in support groups, there's a study that you put pregnant women in support groups and there's 30% less preterm birth just because they're in a support group with other mothers. How do you explain that on a sort of medical basis? There's more to us than our biochemistry. We're
it's almost like there's something to the sort of immediate environment in that respect, isn't there? When you've got a support group, or I think that's in lots of ways, Ian and I recognise as what we did for our dad. We sort of almost created this, almost a false environment around him that was sort of protect. You got all this sort of communication coming in. You talked about the end caps in the supermarkets and things like that. It's exactly that, and it sort of, we didn't allow that, and so we sort of protected him from that until he was at a point where he could see a way forward for himself and actually wanted to continue that lifestyle for himself. So I think you're right. There's but isolation. We're hearing from people all the time at the moment. But
I think
certainly their mental health.
The technology is key. I think one thing I will take forward from this is the fact that people are more comfortable with sort of, people hadn't heard of Zoom, possibly the majority of people before COVID, but they do now. So the thought of joining 12 people on a Zoom call from the comfort of your living room on an evening, I think is going to be far easier to sell to people than it was before. And especially if you say, well, look, at week 4, we all get together and we meet up. And for those who couldn't be on the call, we've recorded it, and here's, you can catch up. And so I think that is going to be hugely powerful for people going forward.
So just to finish, Urmita, it'd be really good just to hear from each of you, really, in terms of your top couple of points, really. If you were going to sort of take from your own experience, what would be your takeaway points for people that, there's, like I say, mainly healthcare professionals watching. So what would be your advice to them, Urmita, first of all, in terms of what they could do or say to a patient, just very simply?
I would say possibly look at them very individually. Don't look at them as just a number on a diabetic sheet, because I think when they look at you, it's very much, I've got, this is another type 2 diabetic patient. Look at them as a person and see how, if they are having conversations about wanting to change their lives in the way they want to take back control, then encourage them to try and see what the other options are. Don't just go down the one route. Really look at the person for the person they are, because I know there's not going to be that many Urmitas out there, but they do need to see somebody encouraging to see that. And that's where I think the groups would help, is that if they had them in the surgery, they could actually relate to somebody that they might see in the village, or they might even catch up with every week and see, oh, wow, somebody that did it 2 years ago has still managed to keep the weight off, as I do with Jeff. And Anthony, I do that with your dad all the time. I always think, well done, look, he does that, and look where he is now. Okay, the cameras are on him, but it's only his determination that's got him that far. And it's got all the support around him that supported him like that. Because I think you and Ian will both agree as well that it's not easy to support him when you're not living with him. But to check in with him, when you check in with him and you know that he's either got some emotions going on, other things going on in his life, those are the dip points where you need the support the most.
Yeah.
And
saying that, I think with my dad, it might have been more difficult if I was living with him. But no, I know exactly what you mean. Though.
Yeah, but I think those are the kind of things that I think credit to you guys that you took control of that. But I just think that not everybody's got that though, Michael, have they?
No.
Not everybody's got the support around them. Not everybody's in a position where they haven't got the children to look after. I'm at a different stage in my life where I think I have been able to put more time and effort into my health at the time that the health actually hit me, if you get what I mean. I think the cancer was the wake-up call. The diabetes was possibly a little bit of a back burner for a short time because it took me a while to recover from just what the chemo had done to me. But what I'm saying is I think that is everything has to be then considered, Anthony. It's not one fits all, that's all. And not to just be sent off with a load of pamphlets or flyers to say, oh, go on, get on with your life and we'll just up your glitz side every so often, or we might just give you a bit more metformin, but you'll be all right.
Would you agree with that, Michael? Is that a fair assessment of what can happen in general practice, and what would be your advice?
I think so. I suppose my advice to patients. So to people who are pre-diabetic or diabetic, and they actually want to take, like Urmita's done, take control of their situation and improve their diabetic control or reverse their diabetes. I think it's about sort of personal responsibility. So if you are that person who wants to take that personal responsibility, I would say once you've made that decision in your sort of mind and heart, then I think the first thing to do is to find allies. And there was a great bit about the whiteboard with BP where Urmita said, look, there will be no one in the kitchen. If you don't help me, so although ultimately you as that individual have got to take the responsibility, but drawing other people into your orbit who are willing to not take the responsibility, but share it and encourage you and challenge them. Say, look, if I don't get this wrong, it's not just me who it's going to affect. It's everyone around me, and we need to find a common solution. And I would extend that then to the healthcare practitioners. So find someone in your surgery or someone or who can actually be part of that solution for you, and go to them. And I think sometimes the majority of patients, now I don't blame patients for this. I think sometimes the medical model creates dependence on the medical system. So patients they come to us and look to sort of us, they look at us as being responsible for their outcomes, if you like. And so we feel a bit overburdened by that. So we think, oh my goodness, there's no way this person's going to, how am I going to help this person? I can give them medication. But if you find someone and say, look, I'm willing to make this, I'm going to work really hard at this. I'm not, you're not, I don't expect you as my doctor to be completely responsible for me at all, but would you just be interested in me? And I've got a few ideas about how things might work. Can you just monitor me? Just see whether I'm being successful. I just need you not to be responsible completely for my outcomes, but just be part of the journey. And you've got access to blood testing. So would you mind actually, my HbA1c is shocking, and I'd like to test it in 3 months rather than 6 months. Would you mind doing that? And I think most clinicians will say, yeah, of course. And I just think to other people who've had bad experiences, don't be put off. Just keep at it. Keep sort of trying to open those doors and trying to get other people on board. And I think we're all, we've all come through a scientific training. We're open, or should be open, to the evidence in front of us. And I think that's what changes people's minds when they see the improvement. We're not there to sort of deny what we see in front of our eyes. So I think, and you've experienced that yourself. So yeah, well done.
Yeah, I think it's really important, Michael, because I do think that if, not all the public, I don't think negatively of the doctors at all. I just wanted someone to sit there and just say, let's give this a go with your support. I wanted their support all the way through it. I wasn't prepared to go alone, but I just think, and I totally get it, for all the Urmitas that want to do this, there's probably 1,000 that don't. And I've seen that within our own family, which is really quite scary. There are members of our family now that we still sit around the table today, Michael, which is really interesting, who are very well educated, who are doctors, and from the medical profession who are taking metformin and taking the type 2 diabetes meds and will say, why are you depriving yourself of a gulab jambu on Diwali? And I'm saying, no, because it's not good for me. And they're like looking at me going, but Urmita, you've only got to take one metformin and one glycoside and then you can eat what you want. And I went, where is the sensing? And it's absolutely mind-blowing that there are, it's not even, like I think years ago I used to say with my mum and dad, it was because of the communication side. I think there was a lack of communication, of understanding the language correctly, to the conversations we're having. But I can sit around a whole table of family members who've got type 2 diabetes who will happily pop a couple of extra pills that day to have a ras malai or a gulab jambu or a jalebi, which is like the Indian highlights of their year.
How do we create more Urmitas then?
Oh God, you don't want more Urmitas, you really don't. BP will tell you that. Please, no more Urmitas.
I think the good thing is, Urmita, I think with your story going out there soon, so this will be released very soon, people will be able to watch all 3 episodes, is just, seeing those patient stories. The more of them you can get out there, the more patients you will have going to the doctor, not just, what medications can you give me, but actually, this is what I want to do with my health. I want to make it better. I want to improve things. And so I want to make changes, and I just need you to support me, exactly as Michael said. And I think that's all we did, with our dad. We went along with him the first time with the GP. We actually changed his doctor because we were getting such sort of negative vibe initially. And we changed the doctor, and then we sort of took this plan of, this is everything we've done. I said, this is what we want to do. We want to get the HbA1c down to here. And we're noticing X, Y, and Z about different foods. And so that's sort of empowerment. But I think it all starts with engagement, and obviously that comes generally out of inspiration and overcoming whatever barriers are there. So, but I think you shouldn't underestimate what a big part you've been in that. You could be a very big part in that.
Inspiring.
Well, one thing I would say, Michael, and I'm really intrigued to know that wherever I've seen anything about type 2 diabetes, about taking back control, there's very few Indian people out there, and yet we're the highest. This is what's like, it would have been great for me to watch someone that had an ethnic background like me to be able to reverse it. So I'm hoping that somebody that does get to see my film will be able to look at it and think, wow, she's got a diet like ours, because that's our biggest, I think that's the biggest battle normally with everybody. Even, it doesn't matter about generations. I think everyone's like, oh, well, they don't know because we have a different dietary requirement. And I think, no, it's for us to take back control of what we do know. You can't push everything onto the doctors because they don't know. And yes, they might not know what we're eating in our homes, but what about our responsibility? It's going back to what you're saying, Michael. You've got to be empowered by what you're doing. You can't push everything back to the clinical professions and just say they've got to sort it because they must have a med for this, or they should have the knowledge because they've been. It shouldn't be like that. It should be like, I'm hoping, that's the thing I'm hoping, is that somebody's going to see this film and think, I can relate to this. I can relate to it, whether it be, the Afro-Caribbeans are the highest type 2 diabetes, as well as Indians, South Asians. So there must be something there in it. And that's only when it becomes relatable to you.
One of the key moments for our practice was showing the Fixing Dad hour-long film to our nursing staff and doctors. I think we were all pretty much on board at this point, but we were like, how on earth are we going to do this? And watching these two brothers kind of encourage, push, persuade, cajole their dad through this. I think people just thought, they were inspired that this is possible. And although it wasn't really about a medical model, it was I think people could see that as clinicians we have a role to play in this. So when people come in inspired, we can be receptive and we can say, yes, this is possible. Of course you can do this. Have you watched Ian and Anthony's dad? Because he did it, and so can you do it, and we can help you. We can cheer you on as you do it. So I think there is that sort of taking responsibility, as an individual, but being inspired to do so. And I think, as you say, how do we, that value of that metabolic health, so as we're all, digging so I get why people, you know, don't want to, you know, it's not about restricting or, you know, sort of making people eat a boring diet. It's about saying, look, there's an amazing diet, a way of eating you can have. And guess what? You know, it comes with great metabolic health, which doesn't come with diabetes, and it comes with less cancer, and it comes with less heart disease and less strokes and less dementia. What's not to like? And you know, these guys have done it. Go for it. And sort of having that sort of setting before people that sense of hope and inspiration, and you know, and let's all cheer on while they do it. So I think that's, you know, that's what I want to see more of in my career in the next 20 years. So
yeah, I agree.
I think that's probably a brilliant place to leave it, actually, Michael. You've both summed up really well there from the patient side and the doctor's side, so thank you.